All right. Hello, everybody. Welcome to the Medicare for All podcast, the podcast for everybody who needs health care. So we have a special kind of live edition today, which is part of the 2021 Medicare for All Strategy Conference. So hello to all our conference peeps out there. And we also have two special guests today. I, as you may know, am Benjamin Day.
I'm Stephanie Nakajima.
And we have with us Mittens Bernie. He's probably not going to talk very much as usual. He's got his mask on. He's all mittened up. He doesn't want to interrupt our program.
I'm sorry, but we finally got Bernie Sanders to the conference, and that's the introduction you're going to give him. Bernie, come on. Thank you so much for being with us.
Oh, yes. Thank you. And by the way, your mask is slightly askew. You just need to adjust it a little bit. But I love those giant mittens. If you're not from the New England area, these are like the most Vermont things you can possibly imagine. And we have also with us Alex Lawson, who's the executive director of Social Security Works. Welcome, Alex.
Well, thanks for having me.
You're exciting too, Alex.
Yes.
Bernie's a whole vibe in that photo. A whole vibe. It's like perfect.
Twitter got everything it could out of that, I think.
Well, when we see your mittens, Alex, we'll decide whether we value you more as a guest than Bernie. But
I know I have finger gloves actually.
Oh my God!
I know. And I'm from Chicago originally, so I know winter.
All right.
But, it's for the phone. It's hard with the mittens. It's difficult.
It's not like the Vermonters know the winter. They own it. So I thought we would, this is our kind of Inauguration Night podcast. Inaugurations are kind of a funny thing. They're like very symbolic, very ceremonial. There's not like a ton of substance there, so we don't want to spend all our time on it. Although I think we should talk about a few important things that happened, like Lady Gaga, for example, and Garth Brooks possibly giving COVID to the entire chain of command. But so let's talk a little bit about inauguration, like our first thoughts about it, and then quickly move on to the bigger question of, what are we looking at for 2021 in terms of the new political landscape? We now have Democratic president, Democratic House, Democratic Senate. This means the Democratic Party basically owns the entire COVID crisis, along with all the healthcare crises with it. And it's kind of going to change the landscape for the Medicare for All movement compared to the last 4 years that we've been dealing with. So as our venerable guest, Alex, what were your initial thoughts on Inauguration Night before we get into the deep shit?
I think the big thing to me was actually like the overwhelming, like, go fuck yourself, Trump.
Cheers.
Cheers.
And all your fascists with you. But I actually, Biden's call for unity, and he asked us not to have, to harden our hearts. And I was like, I'm going to keep it pretty hard. But, I'll go with you a little bit. Because it was 2 weeks ago that there was literally a coup attempt in the United States of America, and they had fascist goons. And we don't want to spend a bunch of time on this, but it was a razor's edge, right? Like if Goodman hadn't had led them up the stairs, it could have worked. If they'd killed a few senators, like probably the vote wouldn't have happened. And then, Trump wouldn't have been president, but our democratic process would have stopped. And so I do think it was important in the pomp and ceremony to just get right back up, literally where they scaled that thing to get into the Capitol, and to do the ritual of the passing of power from one president to the next. And, Donald Trump was such a small man. Like he couldn't even face it, right? Like he's the epitome of a sore loser. And I actually think we can come back to this on like, what does it mean for us going forward? Because I actually think how jagged and horrible Donald Trump is. And I know you all, we've been saying it since 2015, right? And we were getting told like, oh, you're overreacting. He's not a fascist. He's just got fascistic tendencies. And I'm like, or like, that
Just wear fascist makeup. These.
Yeah, and we were told to calm down, and then we were like, look, he did it. He got his goons to try to overthrow the government. Can we admit that maybe, just maybe, we don't have to make common cause and push for unity with fascists? Mm-hmm. Now, if the other Republicans want to throw the fascists out of their party and say, oh, I'm sorry for all of the things that I did, please don't throw me out of Congress, then maybe that's a stance that we can work with. Probably not me, but somebody. That's my main... I was
going to say sort of the same thing. When you examine the concept of unity, it just falls apart entirely. I mean, it doesn't mean anything. And there was not even the word unity was mentioned so many times in his speech, but not once did he give a concrete example of what it would look like to practice unity. And, whenever this weird sort of call for unity happens, I just wonder, like, what would unity have looked like, in the era of the civil rights movement? I think one of the lesser known but more interesting details of the desegregation of hospitals after Medicare was passed is that, hospitals were so resistant to the desegregation. It was so contentious that Lyndon B. Johnson actually had a federal airlifts prepared to take patients, like if there were Black patients that would be ejected from hospitals that did not want to desegregate. He actually had those on standby in case there was just like a total breakdown of the hospital desegregation project. It was absolutely not a period of unity at all, and that's
God, why are you being so divisive, Stephanie?
I'm sorry.
Too, Alex. What's wrong with you?
I mean, that's great. We don't need unity. We just need to win, and then the other team needs to sit down.
My personal theory about all the unity talk in Inauguration Night is that this was messaging targeted at a very specific segment of the country that is probably needed to win in the midterm elections in 2 years. I think they are already starting to target independent voters, in the Midwest and swing states. And as ridiculous as unity is when you actually look at how politics works in DC these days, and how unlikely it is to happen, I think it does resonate well and it polls well with a certain, class of voters who is not us, probably, right? The people who are definitely going to vote Democrat or definitely going to vote Republican every single time. So I kind of feel like even though the language was like, oh, I'm going to be the president for all Americans, I'm talking to everyone, I think that framing in itself is actually a very targeted message crafted by PR firms for a subsection of the population.
And I agree that's where a lot of that, I actually am also really comfortable to go back to the flourishing rhetoric, right? That I can be like, that's all just like good speechwriter, right? Like I like being back there than because like Trump speeches are a disaster. Like not because what he was saying was horrible all the time. He never tried to make people soar and be better than themselves. Unity is a problem when what it means is like being docility, or whatever the word is for that. And I want to say the one thing that I did like when I really liked it when I heard him talk about white supremacy. And I thought that was very bold. And his immigration plan that he dropped on day one, right? And it didn't have a bunch of the Obama era stuff where you just had to sprinkle in cruelty just because, right, to get the bipartisan flavor. You're like, nukes on the border, electrified fences, and dogs, right? Like $89 billion a year. It doesn't have that. So like, I'm for unity if what it means is let's talk to each other and we can work on trying to find common ground, but I'm not going to compromise on my values. I'm not going to compromise on my agenda for what I want to accomplish in this country and the world. And I'm a bit hopeful as an activist who's been here for a long time. I really try not to wear rose-colored glasses. But I actually think the fascist coup attempt that was a bridge that was burned by them, by the right wing, the extreme right. And I think that the establishment might have been more like inclined to be like, oh, come on, let's all work together, guys. The Republicans, Democrats, everyone get on board. We'll do some, milquetoast shit. But now they're like, that happened, right? Like that. And so a lot of it is painting an anti-Trump, right? Like, and I do think that we can guide that. That can be very dangerous if the decisions are just to be against whatever Trump was for. You can't evaluate things like that. You can be against the way Trump was, the divisiveness that was Trump, because it's true. As a tyrant, he divided us, right? And so that unity that I would say in my parlance is solidarity. That's the only unity that I really believe is that when we all work together in solidarity, then we can accomplish great things. And just sort of my final thought, maybe, or whatever, you guys are the bosses, is solidarity is a wonderful concept. But Dr. Paul Farmer, when I was talking to him, he really hit this thing that has just stuck with me. And I remember from his writings, but he's like, solidarity as a concept is okay, but if it's not pragmatic solidarity, immediately making people's lives better, right? Giving people health care who don't have health care. It's cool to be in solidarity with the struggle, but if you're not making people's lives better, then you're not actually doing anything. And so I'm for the sort of flourishing rhetoric. I'm for the fact that he called out white supremacy. That was really good. But now it's time.
But really a low bar also at the same time, right? Calling out white supremacy.
I mean, yes, for like us, but from the inauguration stage, I think it was pretty big. But again,
it was almost not unifying.
It was almost not unifying. Exactly. The Republicans on stage are like, is he talking about me? And you're like, yeah. Yeah.
I think what I hear you saying, I think what I hear you saying is exactly what Bernie was saying this morning, which is, look, I want to work across the aisle. I want to work with the Republicans. I would prefer to do it that way. But if they don't agree with, things that are going to help the working class, then we're going to do it alone. And we're not going to have any problem with that. And I think that that's, it's not, to me, unity isn't about like getting those 500 legislators, Democrat and Republican, to come together. It's about like the working class coming together, right? And taking on their legislators who are not representing them at all. And that's that's the unity I want to see. And I don't give a shit what's going on in Congress.
It's the unity that exists on the issues that we work on. On Social Security. The American people are unified. Absolutely. I go all around the country and I talk, before the pandemic, parking lots filled with Toyota Priuses, or the audience are all wearing camo NRA hats. And when I talk about hating private insurance, everyone's like, yep, I'm super happy I'm on Medicare. When I talk about Social Security, they're all there. When I'm talking about pharmaceutical corporations, they're like, we all hate them. The thing that happens is then that gets sort of distilled into DC and it changes completely, right? Like bipartisan and unity in DC is very different. And, I don't want to make it too easy, but elite unity is not what we're looking for.
We need unity against the elites.
Right. Elite unity leads to NAFTA. Elite unity leads to trade agreements that are written by the pharmaceutical corporation.
Exactly.
And so we really have to evaluate the way that we organize in our policies based on not, the playing field is DC. So you have to understand DC, but you don't comport, what you're trying to do in terms of what people in DC are comfortable with.
Right. So speaking of DC, should we get into healthcare and what we can expect for the next couple of months?
Yes.
Yes.
Ben, what can we expect?
So
Well, you should ask the DC guy, but
You're right.
Yeah, why don't you start on this, Alex? I mean, before we talk about kind of the Medicare for All movement side, let's talk about like the inside DC stuff. Because I started off this podcast saying Dems now own the pandemic, right? And that includes the massive loss of health insurance and poor access to healthcare during the largest health crisis in our country's history for at least a century. So we are going to have Bernie Sanders running a critical committee in the Senate who's going to be responsible for a lot of this stuff. I fear kind of what started happening during the second round of pandemic relief was, Democrats in the House Democratic leadership in the House was kind of proposing stuff that was like way better than nothing on healthcare, but it was so far short of what we need to address people's health needs. It was a bit depressing. It was so far short of our kind of aspirations. But now, Dems are in control, and I think they're going to be held accountable. You can't just run against Trump anymore and have that be like your value system. What do you think is actually going to play out without the intervention of the social movement and many other social movements who have, going to play a role in this? Probably the pandemic relief, I assume, is going to come before anything else. But what's it look like?
Yeah. So just. There's arcane stuff in here that's sort of inscrutable on purpose on how the legislative process works. They like that, they being the bosses, the Wall Street. So there are rules that constrain what we can do, but then it's also really important to remember that the Senate literally writes the rules, so they can change anything that they want, and what they react to is popular pressure. Right. So it's not carved in stone. And if the situation changes, or as reality demands, you find, like, oh, yeah, here's a precedent from 1790. Who would have thought? Right. Like, so
Republicans were rewriting the rules regularly in the last 4 years. Right?
Watch how fast they'll rewrite the rules when it benefits the wealthy few. And then when it's for the people, they're like, oh, we want to, but our hands are tied.
These rules.
Exactly. So I just want to put that out there, that there's both of those realities, that there are these rules and processes, and we have to know how to work within them, because that is where power is. And also that with popular pressure, we can change anything. But so what it's going to look like is, first up, like everyone is on the same page. It's going to be the COVID package, right? An emergency COVID relief package. Now, what does that mean? So Biden put out his plan, which is like, details what he wants. And the coverage stuff in there on healthcare is not actually very robust at all. Subsidies and COBRA stuff. And I'm not even going to get into like the negatives on that. It's just like, it's not enough, right? Like you'd need to put a lot more on. And that's kind of where we were the last COVID package as well, right? Like better than nothing, but not nearly enough. But that's what Biden wants. And that is different than what can pass in the House and the Senate. And what passes in the House and the Senate is what matters. So I think first you're going to see the House, a debate intra-party in the House, where you're going to see progressives pushing for the Biden package plus. And I'm saying like on the inside, and we're going to be saying what the plus is on the outside has to be massive coverage expansion, right? Cover everyone impacted by COVID with Medicare, right? Like we know sort of where those fault lines are. Pramila has a bill with Bernie Sanders, try to add that in, knowing that sort of everyone's going to be trying to do the same thing, because in DC, when a train is moving, a so-called must pass, then everyone's going to hang whatever they can on. But the goal with the House should be to aim as big as possible, because it's an offer, and this offer is going to be rejected. It's going to be rejected by the Senate because it won't get 60 votes, right? The so-called filibuster. That they just decide, well, if it helps people, you need 60 votes. There's no way that McConnell's not going to reject it, right? It's just not, we're not even going to pretend that that's so then what happens is they've immediately sort of have the fallback option, which is budget reconciliation, which is just fancy terminology for what you can do with a simple majority in the Senate, right? So you don't need 60 votes, you need 50 votes, and then the vice president. But importantly, you need all 50, every single one of the Democrats to vote for something. So that's your constraint. But importantly as well, Budget Committee Chairman Bernard Sanders chairs the committee where that reconciliation stuff comes up. And he's going to be dreaming big, right? He's going to want to put as much into reconciliation as possible.
Yeah. So the way
He
that
did this during the Affordable Care Act too, right? He kind of used his vote and leverage to massively increase funding for Kenners, was my memory, in the ACA.
Yeah, he's a master of that stuff.
Yeah.
Stephanie, were you going to say something? Because there's one.
Yeah. No, I was just going to say it's been interesting with the COVID packages because the urgency of the COVID package means that something must be passed. And then there's all this popular, support for, for example, a healthcare emergency guarantee act or something like that. But at the same time, one of the dynamics that we experienced last year was that, the nurses and all of the big unions are also fighting to survive in the COVID, the COVID experience. And so things like PPE and benefits, unemployment benefits, and all that stuff was just essential. And something like Medicare for All or getting us closer to Medicare for All really took a back seat because of the urgency of the immediate issue. And so while it was like an opportunity, because obviously the pandemic has shown how indefensible our healthcare system is, there's also all these other political dynamics that make it really difficult for us to get what we want through these COVID packages because there's just immediate needs that need to be met. Is that what we're going to see again, basically?
To some extent, but there's I'm looking at the comments who are like, oh man, that's not rose-colored glasses, that's really depressing stuff. And I'm like, but we have to be prepared for the likelihood of what you were laying out. But there's a lot to work with at the same time. So a huge dynamic that I think people should be aware of is the Ron Wyden, Bernie Sanders dynamic. And it's not like an antagonistic one, but Ron Wyden, who chairs the Finance Committee, that guy got the UI, the $600 plus up on unemployment insurance through the first package, which is literally one of the most progressive pieces of policy that has ever passed. And it's sort of like no one even noticed. I mean, people who got the money noticed it, but it wasn't crowed as the magnitude of the achievement. So,
and from what I understand, Wyden also supports the Healthcare Emergency Guarantee Act, right?
And yes, and Wyden has so he has his eye on the nursing home crisis. He's a huge proponent of we need health care as a piece of the recovery. At the same time, the other lever is there's this economic crisis, right? And so we need a big UI, something. They're at 400. So you can see how they're going to be negotiating. I think you can see how it takes shape. And it's not just going to be the two of them. It's right. You have help. You have all of the senators. And so we have Elizabeth Warren. We have Sherrod Brown. We have Merkley. We have all of these progressives who are already throwing in a lot of their ideas, right? Some of them on the economic side, some of them on the health side, some of them on the democracy side. Democracy stuff is probably being pushed to the first legislative package out of an emergency relief thing. So this COVID package cannot be seen as the end at all, but we should see it as the beginning. And so we should try to load it up with as many things as we can to make the path to Medicare for All shorter. And that's going to be our watchword the entire administration. Because Joe Biden came into the White House on a promise not to enact the thing that we work to get done, right? So we're not going to have a champion there. but we have a lot of champions in Congress, and we're going to have to get creative in understanding how to evaluate, because we're not going to just immediately get what we want. It's not that simple. And we have to be able to look at things and evaluate them in a way that makes it possible for us to get to where we're going. And again, you know, we have I'll stop talking at some point, but the team that Biden has put into power is actually, you know, like Becerra at HHS, like we've got a lot to work with there. Walensky on taking on pharma power and taking on big concentrated monopoly hospital power. We just have to make sure that we are being united. And on the outside, the movement side has to be united. We can't let it split us up into like, oh, we're going to work to just do this piece and we're going to work to just do this piece. They all have to be bricks laid in a path, getting us towards Medicare for all, getting us closer to Medicare for all. But I do not think that we are going to get to Medicare for all in this first work period of 2 years. I just don't think they're going to do that. But I think things that are on tap is covering as many people with traditional Medicare as possible, increasing the benefits in traditional Medicare so that they look like what we want in Medicare for all, ensuring that any sort of public option-y ideas that even float around are just based on traditional Medicare, and, you know, push out the private insurance stuff. Don't let it just be Medicare, you know, Advantage sort of public option.
So to make this a little bit easier, I mean, just to visualize for people, I think, you know, what we're talking about is a path to Medicare for all, right? And I'm going to pull out the whiteboard here, go Katie Porter on you guys.
I love
Old
it.
school.
And I thought we might do a collaborative whiteboard, you know.
Your screen is frozen. This is going to be hard.
Oh no. All right, I'll keep going. Hopefully I'll unfreeze at some point. But
Okay.
so I think that ultimately our goal is really like socialized medicine, right? Okay. And then the next thing that we want after that is, or before that really, is Medicare for all. So nobody tell the forced to vote people that, you know, we're actually kind of selling out socialized medicine for Medicare for all. So then I think that there's a lot of things that we can do to get there, you know, and some of them are better than others. And some of them are pitched as ways that we can get there, but aren't really ways we can get there. So things like, you know, lowering the Medicare eligibility age. And I don't mean like a buy-in, right? I mean like actually lowering the age and increasing taxes so that it can be funded through the mandatory, you know, spending of the government. What else, guys? What else?
I think what's actually being discussed right now, so these are real policies that you'll see in sort of probably not the first emergency relief package, but there's 2 reconciliations possible in each Congress and what comes after. One thing is right off the bat, though, actually, to just almost digress, right away, we should make it really clear that every state can get a waiver to pursue single payer at the state level because of California and the West Coast, and because that pressure is and New York, that pressure is going to be critical. So the waiver for state-based for pursuing
state waivers.
Adding all children to the federal Medicare program, right? So what we call Medikids. So you lower the age.
I love that.
And that's going to be a big, right? Like Biden said 60, Stabenow has said 55. We should go to 55. Add all kids, but then we should go ACA style on it and just say, actually just add everyone up to 26. So not to 18, but to 26. And now you just added literally everyone from the age of 0 to 26 and everyone between 65 and 55, leaving a much smaller risk pool for private insurance and a much expanded risk pool for traditional Medicare. So now you've just covered an enormous amount of people, and you add benefits in that are on the path to the guaranteed benefits. So vision, hearing, dental, long-term care, adding those benefits in. And emergency relief bills can actually really help get you there by sort of saying what does good coverage look like? Should I go to below your line?
Well, actually, one of the things that I think that my biggest fear actually about single payer is that we're going to get to the point where we negotiate a single payer, but because Medicare has been so heavily privatized and through Medicare Advantage, that what's going to happen is we're going to end up with Medicare Advantage for all, right? So
Yep.
for me, a big thing would be kicking insurers, private for-profit health insurers out of the existing Medicare program, which maybe doesn't seem
Beautiful.
like a really interesting idea, but I would love to, I think there's a real appetite to make traditional Medicare itself a better program, a more comprehensive program, so there's no need for Medicare Advantage.
So if we can, because we're talking to health policy nerds here,
Medicare
which is great.
Advantage.
The biggest problems with Medicare, with traditional Medicare, are that you need Medigap, right? So there's no catastrophic cap. And so you literally need to buy insurance to go on top of your social insurance because they've drilled these holes in it, right? Like it doesn't have vision, hearing, and you're like, what? That doesn't even make sense, except they've created a market, which is actually becoming one of the most profitable places for the private insurers. So if we can actually level Medicare up, that should be a huge thing, leveling Medicare up. We want to say, okay, all of the stuff that you can get in a Medicare Advantage plan, we're going to have it in traditional Medicare. We want vision, hearing, dental. We want catastrophic cap. And we also want to actually, especially the Trump administration, they've put their finger on the scale for Medicare Advantage. So they've had this ad blitz, right? They don't sell traditional Medicare. They sell Medicare Advantage, the mailers that go out and all of that. We should get rid of all of that so that the power of traditional Medicare, guaranteed health care that cannot be denied, grows. And that is how as we do that, we're getting quite close down the path to covering everyone. If you get to 26 and 55, then you only got to get the rest of those, right? And you just keep squeezing it down.
And I think those are two important things. And the other items I would add to this list that I would love to see are adding undocumented people, all residents who are undocumented, to existing public health care plans. So adding undocumented to Medicaid and Medicare, that's going to be essential to passing Medicare for all. Because, right now we don't actually cover undocumented people, obviously, through those programs, but they are being covered in some states through some other mechanisms. And so if we don't, bring them in, then all of a sudden there's just going to be this big hole where we don't have any way of covering undocumented people. And it's just, one of the biggest travesties of our healthcare system that undocumented people right now have such a hard time accessing. So I think that, expanding to undocumented residents, all the public programs, and then finally would be, for me, getting rid of the Hyde Amendment and offering abortion without any conditions through all the public health programs, Medicaid, Medicare, as a federal mandate, because that's going to be another obstacle to passing Medicare for all. Okay. Anybody else? Anything else for the good shit we need?
Over this way, someone over here said, I was trying to point at Mr. Jacob Rabbit, who said negotiate drug prices. That's got to be a huge top priority.
Sure.
Adding long-term care or long-term support and services as well. Mr. Jack Rabbit said, but negotiating drug prices.
Hi, Jack Rabbit.
Can I deviate? I'm only drinking a LaCroix, but if I pretend I'm drinking a Scotch and I can just say one thing about Medikids, which is that justice and health equity, there's nothing, it's just a perfect thing. Children are actually quite cheap in the macro sense from a policy perspective.
Which is why private insurers love them, because they don't cost much and you can rake in premiums, right?
And that it's a small number of cases, $1 million babies and $10 million babies that bankrupt families, but that insurance companies get out of paying for because it's a small number of very expensive health cases. So the justice aspect of it, so that no family is bankrupted or ever even thinks of putting, like I'm going to not pay my mortgage so I can keep my child healthy. That's abhorrent, and we all know that. But there's also this beautiful other part, which is like, imagine what would happen if everyone's first interaction with Medicare for all, with the traditional Medicare program, was for, oh, look, that was almost perfect, for your children.
Medicare.
Hey, buddy. You can't play Zelda, buddy. So that I can do my work. If you can go out with mommy, I'll be here. Come here and say hi to everybody.
Hi. I hear that your sister got rid of Trump single-handedly.
Hey, Xander, do you think that everyone should get health care in this country?
Tough question.
I say yes.
Yes.
He's hamming it up. Hey, go see mommy, and I'll be right out.
Reduce the voting eligibility age to 6. We got this.
But imagine if everybody's first understanding of the relief of the stress and the cares that comes with guaranteed health care is that you don't worry about your children, right? And all of your children you're going to then, as soon as you cycle out of that, or your children do, you're going to hate private insurance even more. So hold on one second, and I will turn on some Zelda for Xander.
I want to go off the side of the whiteboard too at some point.
Go for it. Yes.
So
should I remove? Okay, we still have some space down here.
No, I want to go left or right of the whiteboard. We need another whiteboard.
I need another whiteboard. I'm sorry.
So, I mean, the whiteboard right now, it has policies, right, that we think will actually advance us towards a Medicare for all system that is truly like everybody and everybody out. But another way to visualize the path from where we are to winning Medicare for all is looking at the grassroots movement, not looking at the policies we pass on the way. So, to me, one of the hardest things about trying to, really make progress on Medicare for all during COVID has been that it's really hard to organize, actually, with social distancing, being safe, without being able to meet in groups, without being able to, go into a legislator's office and harass their staff in person. COVID has made it kind of easy for legislators to evade accountability from their constituents. It's harder to get them by phone now. It's really hard to get them on Zoom meetings. They don't respond to emails very well, and you can't just charge into their office and get a person. And so I do think that we're in this, it's been hard to grow our movement at a time when I think all other things being the same, our movement would have been growing rapidly. Everyone, this is so exposed, the failure of the employment-based healthcare system. We should be just seeing a surge of social movement activity around Medicare for all. Yeah. But I think this fact that organizing is so challenging right now has put a little bit of a lid on it. And my sense is that as soon as a vaccine is widely available, the lid is going to pop off. And there is just going to be this explosion of organizing activity, not just around Medicare for all, but around kind of all the things that COVID exposed. So I also feel like over the next, maybe, not the short term 2-3 months, but starting a little bit later this year, we have to think about also the pathway to winning at the grassroots level, which is a whole different task. And you can make massive leaps there without hitting any of those intermediary policy goals, or we can hit some of those intermediary policy goals. I think they're probably going to go together. So I don't know. I just wanted to throw in the grassroots element there, not just the policy side of how we can start to win. Yeah.
For me, the way that I envision those policy goals aren't we have to get Hyde and remove Hyde, and we have to expand to undocumented first before we get Medicare or anything like that. But just, healthcare now, when we started this year, we did a strategic visioning of what does it look like? What does the end game for Medicare for all look like? What does the political environment look like? Does it look like the one we have today? And then we get Medicare for all in this situation, in this environment? Not really. And so it really got me thinking about like what kinds of things, would have to be politically feasible. And those are, I mean, to me, those are the kind of things like sort of, yeah. And I agree totally that we don't have to pass all of those things before we get to Medicare for all. But
it would help.
It would really help, of course.
Yeah. But also the strategy for doing it is a maximalist strategy. That's the way that we win. We always push for Medicare for all, improve Medicare for all. And that creates the room, the political space where our inside actors and more beltway institutions can take it and put in some movement in a decently hostile environment, which is Washington D.C. But outside of Washington D.C., that's what people want to hear, right? You get sick, you go to the doctor. That's what happens. A doctor prescribes you drugs. You get those drugs and you don't bankrupt yourself along the way, right? Simple. And we talk about what we're actually building. And that sort of works with this inside, policy goals where we're going to have to pocket the gains that we can and then demand more. And so I feel like the key thing is the outside. We need a massive mobilization on the grassroots before we really have a chance to move our agenda, which is why I think state-based stuff has is so important to focus some of the attention there. And I just wanted to really bring up one thing that's a little bit, it's not tangential, but the vaccine that we have is near 100% effective. It's as close to 100% effective as you could probably get with a vaccine, because it's, against serious disease, it's about 100%. So it's amazing, which means we can end COVID right now, right? Like at this moment, we can end COVID. We just need to vaccinate everyone. And then, though, we're being sold that there's not enough vaccine, right? Oh, well, the Pfizer vaccine only has this many million doses, and the Moderna vaccine only has this many doses. Do you know who paid for those? We did. The Moderna vaccine is 100% funded by the U.S. taxpayers with a $1 million gift from Dolly Parton, which means Dolly Parton put $1 million more into that vaccine than Moderna did.
Right.
We still call it the Moderna vaccine, and we listen to them when they say, oh, we just don't have enough of it. Take that from them because it's the people's vaccine and get on board with the concept. And this is where I think there's so much opportunity, because when it comes to, do you want the vaccine which can end this pandemic? I don't think we have to, it's going to be everybody. And all we need to do is say, it's not the Moderna vaccine, it's our vaccine. We paid for it. So all the manufacturers in the world, here's the data you need. Here's the marketing, the manufacturing stuff that you need to produce it. Everyone produce the vaccine and vaccinate the world and end COVID-19. That concept, which I actually think there's a possibility that we could get Biden land in on that with Defense Production Act and some of the stuff that he's talked about. That concept is where we can say, this is the healthcare that we're talking. This is healthcare. This is based on health needs. This shows you that the system that inserts profits into healthcare means that we can't provide healthcare. And you remove them, you remove profits from the system, and then we can end the global pandemic. That opportunity to show people what we can do when we work together, I think is, you can't say enough about it. So it sort of goes with what you're saying, Ben. We need to be organizing to get the vaccines that will allow us to organize more in person. Yeah. But it's like, that is what we need to do. We need people to become so outraged that it's not because there's not enough stuff to create the vaccines. It's not because there's not enough healthcare to give to people who need it. It's because we allow a greedy band of sociopaths to restrict our access to the things that we need. And so that opportunity is what the pandemic, this terrible pandemic that has killed 400,000 Americans and over 2 million around the world, that's where we have to say the system, the private system has failed miserably. And we cannot just use a Band-Aid on it. We have to actually rebuild an entire new system.
Yes, and Dolly Care has succeeded where for-profit system has failed. So why don't we wrap up with just some closing thoughts and comments? Stephanie, do you have anything on the top of your head you wanted to close with here?
Yeah, I think we didn't even actually get down to the bottom of the list, which was like public option, like all this stuff that we are obviously going to fight. We're going to fight, a public option. I mean, healthcare now is, I don't know about Social Security works. And
anything that isn't built on traditional Medicare. If you are adding people into traditional Medicare, the risk pool that is traditional Medicare, and you're empowering traditional Medicare, then we're okay with it. So we don't like the public option because it's more of a buy-in. Like we like lowering the age more, but we will fight on the public option to make sure that it's built on traditional Medicare.
Right. Yeah. And by that, you mean like backed by mandatory spending of the government and not its own separate pool, which is
exactly
what you mean. Okay. Yeah.
That it would be traditional Medicare, that it is guaranteed healthcare.
So that's a separate thing that we can talk about on another podcast, but I think we're probably in agreement there about because a public option that looked like that would eventually put insurers out of business, and it would actually be a pathway to Medicare for all. Unfortunately, there's 4 public option bills right now in the House of Representatives, and none of them are backed by traditional Medicare. So as it is right now, the public option is totally like a no-go. And then there's like Biden's, like he wants to just throw money at insurers by shoring up the subsidies for Obamacare, which is an awful waste of our money, and is also subsidizing really substandard plans that don't meet the Medicare for all standard. And so I think we're going to be talking more as the week goes on about the Biden plan and how we can respond to that as grassroots. But I just want to say that I'm really happy that, it's an old activist sort of saying that we don't choose the person who is going to save us as president, we choose our opponent. And I'm so happy to have Joe Biden as our opponent and not Donald Trump, because the window really opens up for things for us. To get done on the healthcare, landscape. So.
Yeah, and I think my final thoughts are very similar. I always have mixed emotions at moments like this. It's like, I think probably for a lot of people, inauguration, despite not having much substance, was like a symbolic moment, basically marking the end of like the terrorization of many communities in America by the Trump administration. So I think it was really important for a lot of big chunks of our population. But then I'm like, when I think about kind of what's the basic things that are wrong with America, usually they don't get better under Republican or Democratic presidency. Our wages don't go up, inequality keeps growing, structural racism doesn't really budge that much. So I also have this like sense of hopelessness mixed in with my acknowledgement of some progress and hope. And I do think like even when you compare, the Democratic platforms this year with like during the early Obama or even the late Obama era, the Democratic Party has been pushed on most issues, and they've definitely been pushed by social movements. So we are inexorably moving forward, the Democratic Party. And I think like Stephanie said, what really changed for me, I sometimes feel like, for our movement, does it make a big difference kind of who is in power and who's not? We still have to add, 118 supporters in the House, and we have to, add whatever 30 something supporters in the Senate. And we have to do that kind of regardless of who has a narrow majority on both sides. But at the same time, I do think that the Democratic Party, their values, they've stuck their values out there as healthcare should be a right. Even those who claim not to support Medicare for all and think you can get there some other way, which footnote, you can't get there some other way. So I do think it gives something to work with. They've stuck their neck out. They claim a value that we are embodying the road to that value. So I think it gives us an organizing opportunity, which is really exciting over the next couple of years. And before we close this out, I just want to give one plug to anyone who is enrolled in the Medicare for All Strategy Conference. Right after this, about 10 minutes later at 8 p.m. Eastern Time, there's going to be this amazing labor panel on Medicare for All and the future of labor, which Crystal Ball is kind of moderating this discussion.
That's in 10 minutes.
In 10 minutes, and it is an all female led panel, all women labor leaders. So that's kind of awesome. So
I feel like you're making history with that.
Tune back in 10 minutes to that and listen to those folks. But Alex, thank you so much for joining us. This was really fun. Thank you, Mittens Bernie, for silently judging us this entire time. I don't know what you were thinking, but I hope it was
really nervous.
All right. Well, have a good rest of your evening, y'all.
Yes.
Cheers.
Cheers.